I'm thinking about this extrajudicial, outside of the formal court system judgments that we make in society all the time. The most important in healthcare is coverage decisions. Is your treatment going to be covered? Is your medication of choice going to be covered? Is the medication that kind of works for you going to be covered as opposed to the one that kind of works but doesn't work going to be covered? I'm trying to do a little bit of video casting to LinkedIn, and I was discussing this on my video casting where a physician used ChatGPT to create the letter that he was going to send to an insurance company to say this procedure should be covered. Of course, the clinical topic, I can't remember what it was. It doesn't matter. I didn't understand it when I was talking about it. And he basically said something along the lines of, take my side in a clinical argument, and he constructed the clinical argument, have a respectful tone, and provide references. So sure enough, ChatGPT just spits out this this thing. What I thought was interesting about that was how there was no question about whether or not I was right. He told ChatGPT he was right, and then had ChatGPT argue for him. And so what I did on live streaming is I just tested to see if I could reverse the polarity entirely. And I said, I'm an insurance company, ChatGPT, and here's exactly the clinical topic, exactly as the physician had described it. Show why that's not necessary and provide references, right? Use a respectful tone. And sure enough, ChatGPT took the other side of the argument and said why that was not acceptable. One of the reasons why I have been so focused on like the judgments that we make and how things get decided is that I think it's going to be substantively outsourced to AI that has access to maybe the parts of your digital footprint that you wouldn't necessarily want them put together in a particular way. So I think the notion we're going, yeah, exactly. I think what we're going to have is, it's like, do I have a problem with the fact that, let's say I've got an STD? Do I have the problem with the grocery store knowing that I bought a cream and them knowing that I got a particular prescription in the pharmacy and them knowing that I was in there, let's say at what time is it right now? It's Tuesday, early morning. Not a normal time for a professional to go to the grocery store or the pharmacy. But if I've got an urgent matter, I'm going to go there. So am I comfortable with the grocery store knowing when I was there, what the medication was, and the fact that I bought a particular item in their grocery store? Sure. I don't have a problem with that. Like, do I have a problem with them putting that all together and knowing that I have an STD? Yeah, I do. I don't like that. That's not their business. So they are, of course, putting those information together, and it's not that they're putting that information together to figure out whether or not Fred has a particular STD or Fred has a particular condition or Fred has this or something else that might be considered shameful. They're putting everything together for everyone for everything. It's just they want to know. It's like they want to have this picture because that's a valuable picture. They can sell me more things if they understand what my problems are, what I'm interested in, and what kind of things I might buy. It's just that in certain circumstances, that information is super damaging. So I'm very, very concerned with AI becoming not just the place. So imagine that happening. Like, we have all of these processes. They're very, very similar to judicial processes where you request to have your medication covered. And then the insurance company sends back and says, no, we're not going to do that. And then, okay, you can appeal that to a higher level and you can say, my doctor's now involved. My doctor's mailing you. And it goes back and forth like this until it actually, and this is the interesting part, almost all judicial processes that are outside of the courts have a moment where they will actually switch to being in the courts. And what I foresee is a human judge looking at a set of correspondence where no human has written anything, right? Where it's been AI on both sides all the way up the top, right? And then the first time that a human is saying, is this judgment that's been reached by this outside deciding system, outside the courts, I don't want to say extrajudicial because that has a meaning, but I think it's hard for me not to say that because I'm trying to give it as, but outside the courts deciding, and then it goes into the courts. And then for the first time, a judge is there reading words, right? That have been written and read by AI, and no human has ever either written or read. So I've been denied my
Mm,
medication, and I know we are working on it. But what I mean by we is the AI advocates for my doctor and the AI advocates for the insurance company have been interacting and trying to sort it out, and they can't reach an agreement. And so now we're going to go to court about whether or not this medication is covered under my insurance plan. I think that's not just, I don't think that's a fantasy. I think that's
yeah, I
going to be
do
the new
too.
normal.